Autism spectrum disorder, also known as ASD, is a complex developmental disorder that affects an individual's social communication, behavior, and interaction. People with ASD may also have different ways of learning, moving, or paying attention. An ASD treatment plan is a personalized and structured approach to address the unique needs of individuals with autism. The treatment plan aims to reduce the symptoms of autism and improve their quality of life. It is typically developed by professionals including individuals with autism, their caregivers, educators, and healthcare providers. The treatment plan usually includes a variety of interventions such as behavioral therapy, speech and language therapy, occupational therapy, social skills training, and medication management. These interventions are chosen based on the individual's strengths, weaknesses, and needs. The plan also outlines specific goals and objectives and strategies for measuring progress towards those goals. It is regularly reviewed and updated to ensure that the interventions are adequate and appropriate. The Principal ASD treatment plan can be used by healthcare professionals specializing in treating ASD, such as psychologists, psychiatrists, speech-language pathologists, occupational therapists, and special education teachers. To use our ASD treatment plan, follow these steps. Download our free ASD treatment plan off our Carepatron platform, which you can find in the link in the description. Gather as much relevant information as possible about the patient's symptoms, history, strengths, and weaknesses. Conduct a comprehensive evaluation including standardized assessments and interviews with the patient and their family. The templates diagnostic section summarizes the patient's diagnosis and related information. Develop measurable and specific goals that address the patient's areas of difficulty. Goals should be realistic, achievable, and based on the patient's strengths and weaknesses. Outline the interventions that will be used to achieve the treatment goals. Indicate who will be responsible for carrying out each intervention. Indicate whether it is the patient, family members, caregivers, or other professionals. This ensures that everyone involved in the patient's care knows their responsibilities. Track the patient's progress towards their treatment goals. Use objective measures such as standardized assessments, observations, and behavioral data. Regularly review and update the treatment plan based on the patient's progress. Here is a sample of our ASD treatment plan from our Carepatron platform. To find our ASD treatment plan, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.